Hello, and welcome to our mini webinar series, Getting Ready for the Maryland Primary Care Program. In today's session, we're going to talk about using the CTO Comparison Tool. As you probably already know if you've seen our webinar series before, practices participating in the Maryland Primary Care Program have the option of partnering with a Care Transformation Organization, or CTO, to help them meet the requirements for the program. Partnering with a CTO isn't required, but for practices that do want to partner with a CTO, we're asking that you indicate your first and second choice for a CTO partner as part of your application. And the CTO Comparison Tool is just a resource to help you do that. You can access the tool by following the link listed here, but it's also available in a few other spots, such as on our state website, where it's listed under Practice Resources, and also in the left-hand navigation bar. And you can also get there from inside the CMS application portal, where it's on the home page under Helpful Links. On the main tool page, you'll see a set of instructions and then a list of counties. As you would expect, you simply click the county that your practice is located in, and that will then take you to a county-specific page where you'll see a table of all the CTOs that are available in your county. While we're on this page, I want to highlight two important pieces of information that are in the table that you'll need when you go to identify your top two CTO choices in your application. First is the CTO ID number, which is in the very first column, and next is the CTO DBA name, which is listed in the middle. Again, you'll need both of those pieces of information for your application. Most CTOs have also provided a website where you can go to learn more about their organization as a whole and what kinds of services they provide. So you can click the link in the table and it'll take you directly to their website. And all the way on the right-hand side, there's a link to view a full summary for each CTO. One quick disclaimer to mention here. The information in these summaries is based on what CTOs provided in their applications, so it's entirely self-reported. The state and CMS don't make any guarantees about the accuracy of this information or what's on a CTO's website. Each of those full summary links will take you to a PDF summary that opens in a new tab. So you can easily open up a few different CTOs and flip back and forth, or you can even print these out and lay them out side by side. Each PDF is structured exactly the same way, so it's easy to find the same information in the same spot and compare across different CTOs. Just to give you an idea of the kind of information that's available in these summaries, the first page of each PDF is a table with demographic information about the CTO, how the organization is set up in terms of ownership and legal structure, what other counties they serve, some of the services they provide, and what EHR and other software they're using. On the second page of each PDF will be a staffing table that'll list what kinds of staff they have and what other staff they might plan to add in the future if they plan to scale up. And the last two pages of each PDF will be narrative essays in which the CTO describes their vision and their approach to care transformation. So you can really get a sense of the CTO's goals and see if they align with what you're hoping to get out of your partnership. Once you've picked out your top two choices, log into the CMS Practice application portal. The link is listed here, but it's also available on every page in the CTO Comparison Tool. Both the tool and the CMS portal will open in separate tabs, so you can switch back and forth to look up CTO information and then enter it back in your application. When you're in the CMS portal, on the left-hand side is where you can jump around to different sections of your application. So you can go directly to the Care Transformation Organization section. If you don't want to partner with a CTO, you can just skip this section. These fields aren't required. But if you do want to indicate your preference for a CTO partner, you'll put your first and your second choice in the fields provided. We're asking that you enter both the CTO DBA name and their ID number into each field. Again, you can find this information in the table that's on every county page, or at the top of each summary PDF. Once you've submitted your application and CMS has approved practices to participate in the program, you'll also get notified about your CTO partner. CMS is going to make every effort to match you up with your first choice, but if for some reason a CTO reaches capacity and can't take on any more practices, you might get matched up with your second choice. Announcements about your acceptance and your CTO partner should be coming later this fall, probably in late October or November. We hope this overview has been helpful. If you'd like to learn more about the role of CTOs or the practice application, we have lots of other mini webinars and other resources available on our website, health.maryland.gov/MDPCP. And if you have questions, you can send an email to marylandmodel@cms.hhs.gov. Thanks for joining, and we'll see you again next time.